Hi, this is Dr. Cohen. I'm here with Robert. Robert's a junior at the University of Southern California, Fight On, and he sustained an injury last summer in August, or was it July?
August.
August,
Yeah, beginning of August.
when he was studying abroad in Ireland. So can you start by taking us through what was your injury? How did it happen? What kind of treatment did you get? What did they tell you?
Yeah, totally. So I was studying abroad in Ireland and I was cooking, and it was kind of a weird accident. I had a knife and I stabbed it into the cutting board kind of like this, kind of a dumb thing, but my hand slipped down the blade and it cut my finger right here and cut the tendon in half, which came down and wrapped around inside my hand. So I went to the hospital in Ireland and they weren't exactly sure what was wrong and they couldn't figure it out. So they just wrapped it up in some gauze and told me to fly home. So
And did they close your wound?
they did not. They didn't put any stitches in it or anything. They just wrapped it up with gauze
And you went to the hospital how quickly after your injury?
right when it happened.
Okay, so they decided to leave the wound open, and they also weren't really sure what to do with the tendon.
Yeah.
And of course, at that point, there was no way to know where the tendon was. In fact, the tendon might have been where it was supposed to be, but by not splinting it and not protecting it, it may actually have done harm by pulling the tendon down into the other parts of your hand. Okay, so you contacted your family contacted someone who knows a lot of physicians, and he referred you to me. And then you flew home on a Saturday.
Yeah, so flew home on a Saturday. Dr. Cohen was nice enough to come in and open his office on a Sunday and meet us, which was great. He saw it and kind of determined what was wrong pretty quickly, and then opened up the OR and made an appointment the next day and came in and got the operation.
Right, and we did your surgery. So we did your surgery within 2 days of you landing, because the wound was already about 8 or 9 days old, and getting close to a time where we might not be able to repair it. So we took him to surgery, and unfortunately, the tendon, the proximal part of the tendon, landed in a place where I've never seen it land. So we had to do extensive surgery to find that piece of tendon. We looked in all the normal places where it was not showing up. Finally, after pretty much dissecting most of that part of his hand, we were able to find it. And here's a graphic image of what it looks like, or what it looked like in surgery. This here is the tendon balled up, and the other end of a tendon is up here. So this part of a tendon, really, there's nowhere for it to hide, but this one hid down here and got caught up where it was not behaving how it was supposed to. We came all the way through the carpal tunnel and looked in this area to try to find it, and it was not in the usual places. So he had extensive surgery. This is pretty radical dissection to put this back together, and the most important part of this surgery is, as they say, first do no harm. Because opening it up like this, there's a lot of vital structures that can be damaged, and that is very concerning as a surgeon, that we don't harm any of those structures. So Robert really worked hard, and he did everything he was told to do. He made the commute from USC over to my office fairly regularly for hand therapy. Then he transferred over to physical therapy, which also in the same community here. So that's Meridian and Body Logic. They both are magnificent. So now here we are, about 4 months later. He's been discharged from therapy. Put up your hand for me if you don't mind. Okay, good. So here's the healing of that graphic image you saw. It comes all the way down. Still, not a fresh wound, but a healing wound, and this will continue to, disappear as the months and years go by. So it's only been 4 months now. Go ahead and make a fist, and then bend your wrist backwards and straighten out. Any deficits that you're feeling? Do you feel weak? Do you feel numb? Do you feel like there's anything you can't do?
It feels pretty perfect to me. Feels like it did before it was injured.
Excellent. Okay, good. So anything else you want to tell people out in the land of YouTube and the internet?
Let's see. Well, came here and I really didn't think that my hand would ever work properly again after I saw kind of what the surgery looked like, and Dr. Cohen told me what was wrong. But here we are a few months later with great care and coming here and going through therapy, and it's all working perfectly, and couldn't be any happier that I came here and got it all figured out and situated, because it's like having a hand that was never injured horribly.
That's excellent, because considering the path you took to get here and the extensive surgery that you had, you've done great. Obviously, everybody out there who's listening to this, we've done this as surgeons many, many times. You've never done it. Real important to do what we tell you to do when we tell you to do it, and not deviate from physician's plan. So, you've done great, and you can take a lot of responsibility for that, because you followed directions and did all the exercise, did everything you were supposed to do, didn't do things you weren't supposed to do, and, really kicked butt with a devastating injury. So thank you for being a good, smart patient.
Thank you. Appreciate it.
All right. You take care.